name is Vera Castin. We are the Group 10 reporter from BSN1-A2. So our report for today is about the case agent rookie. To formally start with our presentation, let me introduce ourselves first. First, I am Kim Charlotte Branzuela.
I'm Kelvin Amaral.
I'm Maria Elizabeth Pitabunan, and we are
Group 10. The flow of the presentation. First, Abaquin's theory, introduction of Carmencita, Dr. Carmencita M. Abaquin, which is the Prepare Me Holistic Theory. Second is the situation. Third is the nursing care plan. And lastly, the application of the theory. First thing is, let me introduce to you Carmencita Abaquin's Prepare Me Holistic Nursing Intervention Theory. Her theory is centered on the nursing interventions provided to address the multidimensional problems of cancer patients that can be given in any setting where patients choose to be confined. Prepare Me Holistic Nursing Interventions are the nursing interventions provided to address multidimensional problems of cancer patients that can be given in any setting where patients choose to be confined. Situation. Monica, a 30-year-old female, was brought to Chong Hua Hospital yesterday. She was diagnosed with COVID-19. She is experiencing labor and difficulty in breathing and loss of sense of taste. She is having chills and has a complaint of frequent high fever. She verbalized, "Before I was admitted, I used to eat a lot, but I have since lost of appetite. For I cannot taste the food. Please help me and don't let me die." Let me give you to Philbin to talk about the case history of Monica.
So, patient complains. She is experiencing labor and difficulties in breathing and loss of sense and taste. She is having chills and has a complaint of frequent high fever. Past medication, admitted before, and other symptoms, loss of appetite and cannot taste food.
Next is the nursing care plan. Elizabeth will discuss about this one.
nursing diagnosed COVID-19 positive, experiencing labor and difficulty in breathing and lost sense of taste, experiencing chills and frequent high fever, loss in appetite due to the not having tasted food. Outcomes and evaluations. After 48 hours of nursing intervention, the patients will be maintained body temperature below 39 Celsius, 100.2 Fahrenheit, maintained body temperature and heart rate with normal limits and verbalized feelings more comfortable. One of the most significant results was an improvement in taste difficulty. Taste below 39 Celsius and 102.2 Fahrenheit, maintained blood pressure and heart rate within normal limits and verbalized feeling more comfortable. One of the most significant results was an improvement in taste acuity, which was measured using subjective and objective assessment scales for a less one aspect of flavor. Intervention. Use Prepare Me intervention before perform therapeutic communications, active listening, and touch. Perform past experience, thoughts, and feelings so that the patients facilitate the adapt to present circumstance. Encourage and elicit relaxations to the patients. Assist the patients to clarify her own belief about health and illness. Outcomes and evaluation. Breathlessness measures by self-reported instruments with the focus on breathlessness or the measure of the breathlessness, baseline dyspnea index, or dyspnea scale, Medical Research Council, Breathlessness Scale, or the Chronic Respiratory Disease Questionnaire. Other term, Other terms for breathlessness such as dyspnea, shortness of breath, and difficulty breathing will also accepted. Intervention: check the mouth and teeth of the patients to check for the disease and inflammatory symptoms. Monitor vital signs, especially the temperature and breathing rate, because COVID-19 is frequently accompanied by fever and dyspnea. Outcomes and evaluations. After 48 hours of nursing intervention, the patient temperature will keep on a normal body temperature as well as normal blood pressure and heart rate. Patient sense of taste will slowly back to normal. Intervention monitors the situation, patients will serve COVID-19 symptoms might develop hypoxia with the levels falling low enough to dissipate supplementary oxygen. Normal 0 to saturation as measured with a pulse oximeter should be 94 or greater. Intervention: manage fever, adjusting the room's temperature, removing excess clothing and blankets, using the cooling mattress, putting packs on the body major blood vessels, starting and increasing intravenous fluid as it permitted, giving out the antibiotic medications I directed, and getting oxygen therapy ready. All example of appropriate hyperthermia treatment. Maintain respiratory isolations. Isolation. All people entering a room with restricted access should wear personal protective equipment such as masks and gowns. Isolation. Room should be clearly identified and limited access. Enforce strict hand hygiene. Patients and everyone entering or leaving the room should wash their hands after coughing in order to lessen or prevent the spread of the coronavirus. Provide information, inform the patient's family members of the transmissions of the COVID-19, the diagnostic procedure, the course of the illness, coronavirus prevention measures.
So, applying the prepare me holistic intervention to the situation. So, first, presence. Being with Monica at times where she is feeling down at the lowest moment of her life, the presence of the nurse is needed during those times. Monica needs a listener and a person who is willing to stay at her side, willing to listen to all her rants. Second, prayer. Prayer is the best weapon out of all things. As a nurse, we are inclined to recovery of our patient. To Monica also, prayer is the best healer. As therapy. Telling Monica or asking Monica what are her past experiences that made her alive and the things that she can apply in the future. Asking her a lot of things that would ease her pain and suffering. Relaxation breathing. Encourage Monica to do exercise breathing to avoid any other complications such as hard breathing and other respiratory illnesses, and also to help Monica relax her mind and her body by the exercise. Encourage Monica to do meditation to relax herself and to divert her attention into positive one. Help her establish a good relationship with God. I will use music to help her relax and meditate or make her write immediately about music and goes in her mind. Value certification. Assess Monica and watch her decision. Being an open-minded nurse develops closure to one another and helps Monica to recover quickly. So that ends our discussion. Thank you for listening, Miss. And this is the Prepare Me Holistic Intervention of Group 10, Section BSN1A2.
Bye.